Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy from Paris, France. Dr. Murphy, how are you?
Doing very well in snowy Paris.
Snowy Paris. Dr. Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and U.S. COVID statistics through today, January 18th. We invite you to submit any questions you have down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with the COVID statistics for the US. Average new hospitalizations per day, 5,144. In 2023, the same week, we saw 6,344. Average COVID deaths per day, up to 204. In 2023, that number was 552. And new vaccine uptake. Adults, 21.4%, those 65 plus, 41.5%, and children stagnant around 8%. Dr. Murphy, your reactions to those numbers?
Well, they're going up. We're almost at what we were last year in terms of the number of hospitalizations per day, but the disparity here a little bit is in the death rate. The deaths have gone up. We're over 200. Remember, we were down around 50 just a couple months ago. But this is the peak season, and we're way below where it was in 2023. And I think the reason for that is that we have enough herd immunity in the population to protect us from the most severe uh, types of COVID, impacts of COVID. So hopefully that number will hold up. But remember, the hospitalization rates go up first, the death rate goes up after that. So it remains to be seen. We are still in the middle of the peak of the winter respiratory season, infectious season, and this is not going to really start coming down till March. So we just got to grin and bear it. And the vaccination rates are about half of what we see with flu in adults. They've crept up a little bit. So some people are getting the message that they should get this. With children, it's way, way, way behind. Both kids over 6 months of age, they're recommended to have COVID and flu. And only 8% uptake in COVID versus 44.9% in flu. So it's only 1/5 of the kids are getting the COVID vaccine. So, they're not going to have the immunity of the adults, because they're kids. And they haven't been around long enough. So they're going to get sick with COVID. This is just going to happen. Fortunately, most of them can handle the infection, but if they have any underlying diseases, it could be very serious.
And on that note, there was a study published recently about the efficacy of Pfizer's vaccine COVID, specifically in children. Could you break that down?
Well, yeah, this is from an article from the Annals of Internal Medicine. It's a very large study of 250,000 children and adolescents. And they found over the Delta period and the Omicron period that there was a 98% efficacy reported in children for the Delta period, and a little bit less with the 74.3% with the Omicron. So the vaccines, it just shows you it works in these kids, it was safe in these kids. And this is an enormous study, 250,000. And that's much larger than most of the clinical trials out there. So this is just more supportive evidence that in kids, the vaccines are very effective and safe to give.
Mm-hmm. And on the actual disease front, I understand that there has been growth in not just COVID, but flu, RSV, the big three, not only in the US too, but globally. Can you tell us a little bit more about that?
Yeah, in the Northern Hemisphere, this is the respiratory season. Um, we're not unique. The Northern Europeans, Northern Asians, we're all in this together. And they reported from WHO that some 10,000 people died from COVID alone worldwide. And about half of those cases are actually being reported from the United States. So that can be for a couple of reasons. Maybe the other countries they're reporting from are better vaccinated, which is actually true. But it could be we're reporting more. Because reporting has dropped off pretty much everywhere. But still, that's still a lot of people dying from a disease that didn't exist just a couple of years ago.
Yeah, and also flu has been very high in the United States, as we reported last week, and also across the Northern Hemisphere, as you stated. But there was another significant study that was published right before the holidays on
Mhm.
the new triple test results, that triple test being a RSV, COVID, and flu test all in one. Can you tell us about those results?
Yeah. If you remember back before COVID came in 2020, if you got sick, very few people actually got tested for anything. Well, in part because of the benefits of COVID testing. We also have rapid flu testing, and there's even going to be rapid RSV, respiratory syncytial virus testing. So we never really knew how much of this stuff was floating around out there, except for some very intensely studied small groups of people. And we tried to extrapolate those numbers. But now, because of these tests, uh, we got a much better handle. So this is a study in 8,329 children who are presenting with some kind of flu-like symptoms, cough and whatever, and fevers and and they found that basically a little under half of them, 47.9%, had either RSV, COVID, or flu. So those are the bad ones. Those are the ones that can land you in the hospital or even cause death, adults or children. So that's good because those three viruses can be prevented by vaccines, or in the case of RSV in children, since the vaccine is only approved for pregnant women and for people 60 and over, there's that monoclonal antibody treatment that is available that can keep kids out of the hospital and keep them healthy and alive. Even though there's a shortage of that, at least it's out there if you can get a hold of it. So there's something you can do to impact these numbers. I think that's really the point. The other half of the infections are milder, less severe infections, the typical colds. They're rhinoviruses and adenoviruses, and they rarely cause severe disease. But the big three can get people really sick. So COVID, RSV, and flu. So it's a nice study, and just we're going to learn more and more about all this stuff. And it's important too because in the next flu season, not this one, those three pathogens are going to be in the same over-the-counter test. You're going to swab your nose, you're going to stick it in instead of having the control band and then COVID band and flu band. You're going to have an RSV band. You're going to have all three of them are going to be there. And typically they break flu out between A and B, so there might actually be four bands on that strip. So that's what the future is going to bring. So when you get sick, you can find out if there's something you can do about it. There's treatment, of course, for COVID and treatment for flu, medical treatments. And RSV, we only have preventive treatments at this time, but that could change too. So this is just very good data to help us in the future when you're going to know exactly what you have as soon as you get sick.
Absolutely. And that's the big takeaway. when I was first looking through this story, I saw around 50%. Maybe that's not as great. And then you read and learn more about the actual context behind that 50%. And, that could save a lot of people a lot of time and a lot of heartache and hurt.
Absolutely.
Lastly, today, bit of a shorter episode, we have a new study showing the safety of the MVA-BN vaccine as used for Mpox. Can you tell us a little bit about what that vaccine was developed for and the efficacy against Mpox?
This is a study from Canada, researchers in Canada. MVA stands for Modified Vaccinia Ankara. Ankara is the capital of Turkey. From a company called Bavarian Nordique, which makes vaccines, and they make this vaccine for smallpox, but you can also, this also works against Mpox. And so they did a big study, and again, quite a few people, over 1,000 participants, 1,173 to be exact. And they found that the vaccine was 78% effective after 14 days, and very, very well tolerated. Mostly the side effects were just some pain at the injection site, which we have with all vaccines. And 3.4% said they felt kind of sick afterwards and were unable to work for a day after they had the vaccine. But that's 3.4%. And this will then protect you most likely from Mpox. So it just adds to the growing body of evidence, and yet another vaccine that's available that can be used to prevent Mpox, yet another big
Mhm.
problem.
And importantly, that this vaccine had such high efficacy after one dose. I know the Jynneos vaccine also had high efficacy after one dose, but was a two-dose vaccine. So, like you said, it's a great option to have in your repertoire.
It's just another option that's safe and effective in one dose.
Absolutely. And on that note, I'd like to thank you, Dr. Murphy, for joining us across the ocean, answering the questions, breaking down the COVID statistics and the articles. We really appreciate your time and expertise.
Well, great. Thank you, and have a great weekend.
Thank you very much. And to all of our viewers, thank you for joining us. If you have any questions or topics you'd like to see discussed, please put them down in the comment section below or to any of our social medias linked in the description. Thank you and have a nice weekend.